I need a drink. Okay, Medical Monday. This was written by Samantha Cullen. So, for those of you who watch football, preseason finally begun. Yay to all of you. And this week's Medical Monday was all about screening for aortic disease, something we haven't really talked about, but there are screening guidelines. And here's some of the things you need to know. So, aortic disease includes conditions such as aneurysms and aortic dissections. They can actually be life-threatening, which we all know way too well. And what just happened? And if it's not detected and not managed early, I mean, as we just mentioned, these things could be fatal. So while aortic disease often develops silently and with no symptoms at all, screening can play a very crucial role in early diagnosis and prevention of severe outcomes. Understanding who should be screened and when you should make and knowing who can be screened and when would really make a very significant difference in the prognosis of those individuals that are at risk. So let's talk about the disease element in itself. So the most common disease elements of aortic disease is going to start with aortic aneurysm. Okay, that's an expansion, a bulge, a dilation in the aortic wall, which can occur anywhere abdomen, or is known as AAA. There's a lot of people that misuse that acronym for ascending aortic aneurysm. That is not the acronym. If you say AAA, it is abdominal, okay? Or these aneurysms can be found in the chest, which would be a thoracic aortic aneurysm or a TAA. Then you have aortic dissection, which is a serious condition when a tear really develops in the inner layer of the aortic wall, which causes blood flow to happen between the layers. And that will ultimately produce a true lumen, which is a real path to feed the blood to all of your organs, and a false lumen, which typically thromboses or blood clots, and it leads to nowhere. But that in and of itself could potentially cause a rupture, and a rupture would be a tear outward through that outer layer, and that, depending on that location, really increases the chances for mortality, your mortality rates. Aortic stenosis, another common disease element that we often hear, really because it pertains to the valve, and that would be a narrowing of the valve. And any kind of stenosis means narrowing and hardening, and this can actually lead to reduced blood flow from the heart into your aorta. Conversely, you've heard of aortic regurgitation. So that would be that the valves get a little flappy and there's backflow blood. So we don't want that either. All right, so this is why screening is super important, everyone. The primary goal of screening for aortic disease is to detect conditions like aortic aneurysms before they actually cause any symptoms. And they are typically asymptomatic unless you have one that's maybe in the ascending or arch and it becomes so large that it's impacting your breathing or swallowing. Or if you have one in the abdomen and it's so large that you're feeling some discomfort and you can see pulsating in your belly. These are all things to talk about with your physician to determine what symptoms would yield you to believe that you are in fact symptomatic. And some of these things can become life-threatening. So aortic aneurysms, for example, they can grow pretty large over time and eventually rupture, which would lead to severe internal bleeding and death if not promptly intervened and treated. So early detection through screening really allows for monitoring, medical intervention, medical management, et cetera, and surgical intervention if necessary. Who needs to be screened? This is important also because these changes have occurred over the last 10, 15 years. So screening recommendations for aortic disease on identifying individuals that are at the highest risk of developing severe complications. So the guidelines for this really vary on the type of aortic disease and the presence of the risk factors. So if you want to be screened for an abdominal aortic aneurysm, this is the current screening in the United States, which should allow you to be screened for free. Of course, don't take what I'm saying at 100%, I think, but you know our memories, but I think that's true. Any man aged 65 to 75 who has ever smoked, ever, I'm not talking just like one little puff, but if you're smoked, 65 to 75, you are at the highest risk for developing an abdominal aortic aneurysm. So a one-time ultrasound screening is recommended for men in this category. And an ultrasound is just a wand that rolls around on your belly to look for and detect any aortic aneurysms in that area. Non-invasive, doesn't hurt, a little squishy with the jelly, but other than that, it's nothing. Now, men that are over 75 with a history of smoking or a family history of an abdominal aneurysms, these screenings should be considered on a case-by-case basis, taking into account overall health, the whole picture for that individual that's over 75, and potential life expectancy. Now, women age 65 to 75 who have smoked and have a family history of an AAA, because we're less likely to develop a AAA, I don't think they cover screening for us. So it should not come as a shock or be surprising. It's just ridiculous. But it's something you need to talk to your physician about, because if you have significant risk factors, if someone in your family has had one, if you've smoked, other risk factors, blood pressure issues, et cetera, overweight, talk to your physician and see what they can do to get you that scan. But there is nothing here that says you have a one-time scan, because we're not entitled to that. But again, if you talk to your physician, they can go ahead and coordinate scheduling that scan for you. Ultrasound, it's simple and it's easy. Now, individuals of families who have a history of a AAA, regardless of their gender, okay, those with a first-degree relative, like a parent or a sibling who have had a AAA, might require screening a little bit earlier than the general population, because there is a potential genetic component. Things get a little different when it comes to thoracic aortic aneurysms. So if you have a genetic predisposition, those with a genetic condition like Loeys-Dietz syndrome, Marfan syndrome, Ehlers-Danlos syndrome, you really need to undergo regular imaging studies. Okay, that's going to be different than an echo. You would need now an imaging study. So that would be, well, it would be an echo, but not an ultrasound, I meant to say. So it would be an echo or a CT scan or an MRI. Notice I said or, because either of these are acceptable. There are people in social media land, specifically Facebook, that like to say that and CT is the only acceptable. No, it is considered golden standard, but you will receive an effective scan result that a physician can read and look at if you have an MRI or if you have an echo. Echo does change things a little bit. Measurements might be a little off. And I understand that measurements are very important, but when in urgent need or in this is what you have available to you, because not everybody always has all of these tests available, then you take the echo, okay? And you need to do the surveillance starting in adolescence or earlier, really depending on what type of condition you are aware that you have. Now, if you have a first-degree relative and you have thoracic aortic aneurysm disease, then the family members of those that have been diagnosed with a TAA may also need to be screened, particularly if the aneurysm was identified at a younger age. And younger meaning, I believe, 45 and under. So yay, if you're 44, you're considered young in this. Not that you're not young compared to me also, but particularly if it was identified at a younger age or was related to a genetic condition. Okay. Now, when it comes to aortic dissection screening, high-risk individuals. So these screening is not typically performed to the general population for something like this. But for those who have a family history of aortic dissection, specifically aortic dissection or a genomic syndrome associated with aortic disease in general, or a history of uncontrolled blood pressure, might really benefit from an imaging study to assess the aorta's condition. Like, what is the overall health of your aorta? Meaning, are there any areas of bulge, aneurysm, slight tear that you had a pain and thought it was gas? I mean, there are people that do walk around having had small dissections and didn't even know it happened. So again, if you have family history, you need to talk about having a scan, having some type of diagnostic test. And the good news is, if you're doing a CT or an MRI, they can check for both things at the same time. You don't need to be checked twice. You can be checked overall health of your aorta. Okay. Screening. Let's talk about how it's performed. So the primary methods for screening aortic disease are an ultrasound, And that's a non-invasive test, and that's used for screening abdominal aortic aneurysms. You're not going to use an ultrasound for the thoracic. It's going to be in the belly. And it uses sound waves to create images of the aorta and detect abnormal dilation in the abdomen area. CT scan, computed tomography, CT scan. They're very quick, but they're typically with a dye that some people might be allergic to, but it's a detailed imaging technique that provides cross-sectional views of the aorta that's often used to diagnose thoracic aortic aneurysms and dissections. CT. Now let's talk about magnetic resonance imaging, or MRI. Sometimes people will also say they get an MRA. We're talking the same thing, okay? But it's an alternative to a CT scan, and MRI provides detailed imaging without radiation exposure. Now, the radiation exposure you get in a CT, especially if you are getting it low dose, which is pretty typical, it's extremely small, but I can understand why people would have some anxiety around that. So it's a conversation you need to have with your physician, okay? But MRIs, it's no radiation exposure at all. It's often used for people with different types of genetic conditions. They'll use an MRI, but you can use it for anything. It just takes about 45 minutes to do chest and abdomen and pelvic area. And you are going to typically have a dye. It's called gadolinium. It does not produce the same side effects when injected as the dye, the radioactive dye with a CT scan. The last test is an echocardiogram, or an echo, and that's an ultrasound of the heart. It is a different type of ultrasound than what happens in the belly. And this can also help visualize the aorta, particularly detecting thoracic aortic aneurysm, but it also can detect if there's an issue with your valve. Okay, that's going on there. So what happens after you're screened? This is interesting, but if screening detects an aortic aneurysm or any other abnormality, the next steps really depend on the size and the location of the problem. So small aneurysms, they will probably just be monitored and having regular imaging studies, while larger aneurysms may require surgical intervention sooner than later. Patients that are diagnosed with aortic disease really need to work closely with their healthcare providers to kind of manage those risk factors, such as high blood pressure, and just overall to work to determine the best treatment plan. Raising awareness about screening. So despite the serious risks that are associated with aortic disease, many at-risk individuals really remain unaware of the need for screening. They think they're look, especially the people who have dissections think, I'm done, you fix me, I'm done. Little do they know, they are not done. They need to be screened the rest of their lives. So public health campaigns and educational efforts, they're really essential in informing those that are at risk about the importance of screening. This all becomes part of thinking about your aorta. Think aorta, think family. You just need to be thinking about it. And early detection can actually lead to life-saving treatments and better outcomes for individuals with aortic disease. So if you or a loved one falls into that high-risk category, talk to your healthcare provider about screening. Have that conversation. Being proactive can actually make all of the difference when it comes to preventing the potentially devastating consequences of aortic disease. And that was Medical Monday. And Sam says, have a great weekend, and always remember to think aorta.